for joining us. Today, we're going to be presenting to you. I'm Michaela Kanzer, and this is my co-presenter and co-author, Valentina. We also worked with some faculty and staff at our University of Florida. So that's Dr. Laurie M. Baker and Dr. Ashley McLeod-Morin. They're not going to be joining us today. They may hop on and help us answer questions at the end, but for today, Valentina and I are just going to present to you what our research project was, what we found, and how you guys can use it in your communication. So Valentina is going to get us started and kick us off.
Excellent. Thank you so much, Michaela. As Michaela mentioned, we worked together on this project, which was a content analysis that investigated how the CDC framed social media communication with the public during the COVID-19 pandemic. Let me make sure I can. All right. So of course, as we all know, COVID-19 has been a really big part of our lives for some time now. And on January 31st, the World Health Organization declared COVID-19 a global health emergency. And by the end of May of that same year, the amount of deaths in the United States had surpassed 100,000. So of course, this very quickly became a very big part of our lives. And during this time, the United States Centers for Disease Control and Prevention, or as we often know it, the CDC, began communicating preventative measures with the public on their existing channels of social media. So things like making sure that we're washing our hands, using an alcohol-based hand sanitizer, and wearing face masks. Those are messages that were frequently put out on their websites, but like I said, also on their existing social media channels. And throughout the COVID-19 pandemic, we did see that a lot of messages related to COVID-19 involved the use of frames. And so all framing means, oops, my chat button there. All framing means is it's the way that information is organized and constructed in a message that assigns meaning and provides context to the topic or phenomena. And this is really helpful when communicating about complex issues such as the COVID-19 pandemic, because there's a little bit of background information that is required to fully understand the disease. And studies that analyze the use of framing in COVID-19 related messages found that messages that frame the disease as a public threat were more effective at motivating the public to take part in preventative measures against COVID-19 than those that frame the disease as a personal threat. And on Twitter, researchers found that messages about COVID-19 often used war-related terminology to discuss the pandemic, and that actually analyzed with frames that were being used by the media around that same time. Another thing that we saw frequently in messages about COVID-19 and the pandemic were the use of tone of voice. So tone of voice can be divided into two different sections, and that's human and organizational. So human tone of voice is often seen as more conversational, authentic, and engaging, often done from a first-person perspective. It can increase perceptions of social presence and intention within an audience for that organization. On the other hand, an organizational tone of voice is frequently seen as more impersonal and less authentic when compared to a human tone of voice. And some studies have found that using a first-person conversational tone of voice can increase the perceptions of social presence and intention within the audience. It also resulted in greater engagement and relationships between an organization and their audiences in a study found examining communications on Twitter. So during a public health crisis as big as the COVID-19 pandemic, there's a need for organizations like the CDC to maintain a positive relationship with the general public while ensuring that the organization meets the changing needs of scientists and public leaders, both in and out of the government. So one way to do this or to measure how this is done is through organization public relationship or OPR indicators. So OPR indicators include control neutrality, satisfaction, trust, exchange relationship, communal relationship, and commitment. And again, these are used to describe the interconnection between an organization and their target audience, where decisions and actions of one party directly influence the other on an economic, social, political, or cultural level. Here's a list of all 6 OPR indicators, and I won't go too far into what each and every one of these mean, but again, we've got the 6, and I just wanted to point out that trust actually has some sub-dimensions, which include the way that the audience perceives the organization to be fair and just, and will they do what they say they will do? And do they have the ability to do what it is that they say they will do? So all those components are really important when determining trust between an audience and their organization. So with all that in mind, as I said earlier, we did a content analysis of the CDC's communication with the public during the COVID-19 pandemic. And in order to do this, we selected 5 videos about COVID-19 from the CDC's Facebook page that directly address the public. And then we selected these videos because they directly address the public and they allow researchers to examine frames that were used to discuss COVID-19. And so up here you can see the list of those videos. But basically what we did is we took these videos and we analyzed them for frames, including tone of voice. So did they use a human tone of voice or an organizational tone of voice? And we analyzed for frames that identified the 6 OPR indicators as mentioned in the previous slide. And so next I will hand it over to Michaela to discuss our findings.
Perfect. Thank you, Valentina. So I'm just going to hop right into our findings. So we have 3 research questions, and the first one where it was, how did the CDC frame advice about preventative actions related to reducing the spread of COVID-19? So we found a couple of prevalent themes. So community, protecting yourself, understanding, and encouragement to take action. Those were 4 frames that we found to be pretty prevalent in all of these videos in our sample, but fear was present a little bit, but not a lot. It was the least prevalent theme that we found, which as communicators, y'all probably know that's a good thing. So to just kind of go through some of these frames and have some examples. So for community, we had cloth. An example that we pulled from one of the videos was a quote that said, cloth face coverings are meant to protect others from the respiratory droplets that you produce. So we decided to code this as community because it put an emphasis on the teamwork aspect of protecting not only yourself, but each other from COVID-19. And then for the frame of protecting yourself, a quote we pulled was, keeping yourself and your children 6 feet apart from or more from others. So we pulled this one and framed it as protecting yourself because of the emphasis on really protecting you and protecting your family from COVID-19. So not as much of that emphasis on protecting others, but on protecting you and yourself. And then for the frame of understanding, we had wearing a cloth face covering may not always be possible. So we decided to code this as understanding because it indicated some level of understanding that there were multiple parts of the pandemic that were new and that were challenging. And you can see some other quotes there that we pulled as well that really emphasize that, that indicated there's some level of understanding that we're all working through this together and we're all trying to figure out what's best for us and for our families. And then for encouragement to take action, an example there is to remember to frequently wash your hands. So these videos were slam packed full of encouraging their audience to take action, whether it was to wash your hands or to wear a face covering or to social distance or to learn more information at this link or this website. So that's kind of how we framed that or pulled that frame, determined that frame. And then for fear, again, that one wasn't super prevalent, but it did show up in, I think, one of the 5 videos and one of the 5. But an example there was really emphasizing the risk of the associated with COVID-19. So not really talking about solutions, but really looking at, what is the risk and therefore kind of giving a little bit of fear there as well. So our second research question was, how did the CDC frame its tone of voice and communication with the public related to COVID-19? So this is here talking about that human tone of voice that Valentina introduced to us earlier. So 4 out of our 5 videos in the sample indicated a human tone of voice and were coded for human tone of voice, but 1 video was coded for an organizational tone of voice. So statements that indicated a more human tone of voice or a more personal tone of voice were statements like, let's work together to keep our family healthy, or let's taking care of ourselves is important, or even really talking about, I know this is a really difficult time for everyone, so be sure to take care of yourself, be sure to check on your mental health. So those are kind of ways that the CDC used a human tone of voice in this type of communication. The more organizational tone of voice is a lot more impersonal. So those were kind of more of like a talking head, if you will. Someone in a suit that didn't introduce themselves. They sat down and they just delivered the facts and they talked about things, some of the quotes we have here that we pulled, you can read, but an example is, older adults and people of any age who have underlying medical conditions may be at a higher risk of severe complications from COVID-19. So really, again, nailing down and really emphasizing, the facts about COVID-19 and the risk, but not really trying to be, not really giving any emphasis on two-way communication or making it feel at all conversational. Then for our third research question, the question was, how did the CDC frame its relationship with the public using OPR indicators? So Valentina talked a little bit about those OPR indicators earlier. So I'm just gonna read through some of these and give you some examples and kind of tell you how we decided to code certain statements with each indicator. So let's see. So some of the ones that were most salient in these videos were community, protecting yourself, encouragement to take action, and understanding. And then we so as far as trust, so an example of trust was the statement that we used was, we reviewed the literature regularly and speak to colleagues. Also examples of people introducing themselves and establishing their role in the CDC. So this was a great way to establish trust because it established the authority and established trustworthiness. So we knew who John was and what he did and what his credentials were and why he was the person that was credible enough to talk to us about these topics. And also, talking about how they were continually doing their research, speaking to their colleagues, speaking to other people, about the things that were going on. And so trying to continually deliver the best information to their audience. Communal relationship, our example there is, let's work together. My cloth face covering protects you and yours protects me. We're helping each other. So this kind of shows how both parties are providing benefits to one another and really, again, emphasizing that teamwork element there. And then for exchange relationship, as we learn more about what this means for you and for your home, we will keep you informed. So one party, AKA the CDC, was transferring benefits, aka information, to its audience. So it kind of shows that one way of, we're committed to providing you with benefits, you being the audience. And then we have control mutuality, which an example of that is, we've been getting a lot of questions. So we can see here that the audience was looking to the CDC for trust and looked at it as an authority. And so it kind of established them in that way. For commitment, we are going to continue to monitor the situation. As things change, we will let you know. So this demonstrated the commitment that the CDC had to its audience to continually conduct research, to educate their public, and then to communicate their findings and the new information that they had with their audience.
Sorry about that. I was still muted. Thank you so much, Michaela, for getting us set up. So that is pretty much the end of our findings. So now we want to talk about some recommendations that we have for communicating or crafting messages for ag science communicators moving forward. We do believe that with the new extension framework, this really positions extension in a good place to have these conversations related to risk and health within their communities. And so while social media videos can be really helpful when communicating complex topics or the importance of scientific information, we want to make sure that we're using a human tone of voice and using certain OPR indicators when we're crafting these messages. So a big thing definitely is to avoid fear frames when communicating about health risks and zoonotic diseases. For example, instead of saying COVID-19 is dangerous, people are dying from this disease and we're all in danger, saying things more like, we can protect ourselves in our communities by washing our hands to slow the spread of COVID-19, that can help make those messages a little more effective by implementing that human tone of voice and using those OPR indicators as well. Next, it's really important to make sure we're building and maintaining relationships with the public before a crisis occurs by, again, incorporating that OPR framework and using a human tone of voice in our external communications. And then I think that's all I have for you, and I will hand it back to Michaela.
I think it's important too to kind of remember all the ways that we communicate, right? So sometimes it may be a social media post that's just text and a graphic. It may be a video, like it was in a case here that we were, like it was in our sample for this study, or it could be, a newsletter, or just think about all the ways you communicate and really how all of this information can be applied to all of those different types of communication. All right, so here we have an example for you guys. So as agricultural and science communicators, we should be trying to establish a trusted brand and spokesperson for our brand before a crisis occurs. And so kind of as Valentina mentioned, Extension is positioned extremely well to do this. They have spokespeople embedded in all communities around the state of Florida. And so it's really important that we leverage those relationships and that that person is working in their community during, all the time. And when there's not a crisis, when there is a crisis, and they, And so they're establishing those relationships, they're establishing their authority, they're establishing themselves as a trusted source. And so when there is a crisis, it would be a really great time to really emphasize those people and to spotlight them and the relationships that they have in their community. And so we can see how that kind of translates to visual communication. So in this example, if we are spotlighting someone on social media, maybe instead of using a stuffy headshot of them, maybe using a photo of them in action in the field, really something that's a lot more relatable, right? So that not only will that help you to establish trust and establish a trusted person or spokesperson, but it also helps you to be a lot more also helps you to use that human tone of voice, right? So you can do that to have a human tone of voice, not only in your captions or in the text of what you're trying to communicate, but also in the way that you're communicating visually. Okay, perfect. And then here's another example that I just personally wanted to share because I think it's really fun. But this is an actual photo that was used in Cedar Key during COVID-19. One of our researchers took it, and and so I just wanted to share it with you guys today. But this is a really great example of using human tone of voice in your communication and in real life and during a crisis. So this is in Cedar Key, and so Cedar Key is known for their clam farming, their clam harvesting, their clam industry. And so everyone in Cedar Key is familiar with a clam, familiar with a clam bag, right? So the sign says, social distancing, please stand 2 clam bags apart. So this would be a great kind of thing to share on your social media and to caption it with something that's very personal, like this is the most Cedar Key way to remember the CDC's guideline on COVID-19 social distancing. Remember to stand at least 2 clam bags apart. So just kind of try and think about what you're trying to communicate. Here, this isn't communicating something, a very important concept, right? But it's also doing it in a way that people can relate to, in a way that's fun, a way that's easy to remember. And so whenever you're trying to communicate or when you're planning about what you're going to communicate, think about that message and how you can frame it with a human tone of voice or with, a way that is that's more conversational, that makes people feel like they want to engage and like they want to listen to you.
Yeah, thanks so much, Michaela. So again, looking forward at some communication materials and the way that OPR indicators can be used. Here we have some examples of some public opinion survey results as well as communication materials from 2 centers that Michaela and I have worked with in the past. So it's the Southeastern Coastal Center for Agricultural Health and Safety, as well as the UF-IFAS Center for Public Issues Education in Agriculture and Natural Resources. So on the bottom left, you'll see results from that public opinion survey, what Americans think about COVID-19. And that was a survey just asking about the public's perceptions of the pandemic. And results from those surveys were actually used to help put together some educational toolkits. So you'll see on the bottom right, there's a COVID-19 training toolkit for extension. And like I said, we used some of those survey results to put these materials together to understand what the public's concerns or where there were maybe needs for information and addressing those needs through communication materials. So here we see an example of control neutrality and trust because we did use audience survey results and they influenced the creation of these materials. And then we did see as the pandemic kind of moved forward and things changed, there were the development of the Delta variant. We made sure that these materials were updated over time. These centers made sure to stay on top of that and provide new information over time. So when the Delta variant arose, there were new materials that were put out addressing concerns for that variant. And so that expresses commitment, which is maintaining a long-term relationship with your audience. So these weren't kind of one and done, put these out and just leave them out there. There was an effort to make sure these materials remained up to date and met the needs of the audiences. Then we found that both the organization and audiences actually benefited from these materials. So this is an example of satisfaction where both the organization and the audience benefit from that relationship. So by putting these materials out, the audience benefited because these were materials that could have been really helpful to them. And of course, the organization benefits as a result by having their materials put out there, but also if the audience is using these materials and lowering the COVID-19 transmission rates, that's a benefit to the organization too. And then as an example of communal relationships, which is helping the audience without expecting anything in return. So the organization making sure to be there for their audiences again, without really asking for anything in exchange. These materials were free, so nothing was required of audiences to use them. They did not have to really sign up for anything or make any commitment with the organization. These were just kind of provided for free to the audiences for their use. So this is just an example of a few of these OPR indicators. I think this is 5 of them, so all but one, how they can be expressed through communication materials and kind of improving that relationship between an organization and their audience.
And so I think it's really important to remember too that talking about these OPR indicators is kind of not like just a one and done. You can't put one post out there and show all 4 of these. It's really about the continual relationship and how you are maintaining that relationship with your audience from start to finish. So I think that is probably is our last slide, Valentina.
Yeah, this is it. And then I think just one last thing that I forgot to say was another need that was represented in these audiences was the need for translated materials. And so that's something that the organizations made sure to do, was to take that step forward. And I believe a lot of these were translated. They were English, Spanish, Vietnamese, and Haitian Creole. So that's just another way that you can kind of listen for your audience and develop that trust and that control mutuality. Just keep that conversation with them going and make sure that the materials you put out are reflective of their needs too. But yes, that's actually all I had for you.
Perfect. Yeah, great point too, Valentina, about making sure we're always considering how we can make all of our communication inclusive. I'm going to put a link in the chat as well. This link goes to our paper. It's actually been published. So if you guys want to check it out, you guys can follow that link or jot down the link on the screen. And you can download our paper and read more detail about all the things that we found. And so I think now we can answer any questions that you guys have. If you just want to unmute yourself and ask us, we can see if we can answer. All right. If there aren't any questions, I think that's all that we have for you today. Heather, is there anything else that we need to add or let anybody know?
No, thank you. That's great.
All right. Well, thank you guys so much.
Thank you.